the biggest reason for loss of teeth is gum disease, not cavities.
Right, but as I said, never mind the loss of teeth. It's for 5-6 years poisoning your body, getting that yellow, ugly, reddish pus in your mouth and getting it all over the kidney, liver, blood, brains, eyes, getting your immune system down, and then wondering why you have a flu and a cold 7 times a year.
That's certainly the case, and bacteremia is bacteria in the blood. Septicemia is getting septic things in the blood, like pus and the things you're talking about there. That's septicemia. And then, your bloodstream carries it all over the body. Yeah. And it settles in different places. It's not a good situation.
No. And so show us how you show your patients how to brush. Let's go back to what we started off with.
So here we go. And you use a little bit of toothpaste. You don't need much. I start in the back. I'm brushing now the upper left quadrant.
Okay.
And I run to the left teeth, and then the corner, and then the front. Now, the thing is, on brushing, you don't want to change. You get the stroke for the brush going, and you don't go changing the brush around. You move your head to do the brushing.
Show me this again.
Okay, here's the deal. I'm brushing here, and I move my head.
You're moving
I just keep brushing in the same position.
Okay.
Okay, now most children don't have the dexterity to brush, but I teach them to get a stroke going and then just move their head. And they don't have to move but if they have to move their hand and their head together, that's too much to happen. But if they hold the brush and get a stroke going, then they just move their head and they keep brushing, okay?
Yeah.
And so it's like putting using a lathe or something.
Yeah.
To
now show me how you get to this side's back corner. Show me how to do that.
Okay. You get all the way back here to get into the back of the top molar, and then you do the molars. You keep turning your head, and do the corner and then the front, and then go at the bottom. Do the same thing. Move the head. This side.
Okay, so you then angle it in. Okay, and then you start. Okay. All right.
Now, I've gone over teeth on the outside of the teeth 1 time.
Yes, okay.
On upper and lower on both sides.
Yes.
And I'm going to do that 4 times.
Okay.
Go over the teeth 4 times.
Okay.
And one time will take about maybe 8-9 seconds.
Is that what you did now was about the real timing?
I think I do it a little faster.
Okay.
Okay, so I'll go over the teeth 4 times. 1 time on the inside, because your tongue keeps everything pretty clean on the inside.
I see.
But again, I'm going at right angles to the teeth.
Show us how to do that. Same thing.
And then overhead.
Right.
And I'm brushing the front, inside the front teeth, back and forth this way. Not straight up and down. That's no good. You won't get in the surface.
That's what I do. Straight up and down.
I know. That's the way you're taught to do. But now you don't get taught. Not in my office, you don't. Okay. Here. And then the upper. But I move my head, not the brush.
Right. Well, when you first said move your head and not the brush, I thought you meant jerk your head.
Well, I think, a 7-year-old to brush, that's what they start doing. And I tell them to hold their head and move their hand. Don't shake their head, but just turn their head.
You definitely scared me there for a little bit.
Try the upper, and then the lower. one time over the top of the teeth, the chewing surface. And I'm done.
Good. All right,
and,
wonderful.
You know, right now, I've gone over my teeth a couple of times, and my gum tissues feel so great. They're all stimulated. They're so happy, and they're teeming. They just feel good.
Great. Absolutely great. One more question about this. I've lived in India for a couple of years in 95, 96 kind of, and I still go there once or twice a year. I do a fair amount of business there and things like that. But what the Indian people, what I saw there, is they have a tongue scraper.
Yes.
They have a tongue scraper, and they scrape the tongue. Should we do that? Do we have something like that? Is brushing it instead of the tongue scraper a good thing? Should we brush the gum up, and the tongue? Yes, no? Should we get a tongue scraper? Shade a little light on that.
Okay, tongue scrapers. There are a couple of manufactured toothbrushes that put a tongue scraper on the back of the brush.
Oh,
They do that today.
Okay.
In my office, along with an orthodontic examination, I examine the tongue. It's the biggest thing in the mouth, and hardly any dentist ever looks at it. And so I look at it, and there's a great variation of the anatomy of the tongue. Some people have a Grand Canyon down the middle of the tongue.
Those are probably the tongue stickers.
Well, whatever it is, they need to brush their tongue or scrape their tongue because they collect all this in there. And I'll look in some patients' mouth, and they'll have a brown film on their teeth, on their tongue, and they need to do something about that. And when a person has an upper respiratory, cold, head cold type thing, their tongue is usually all infected.
Yellow.
And they should brush their tongue or use a tongue scraper.
Right.
You go into the drugstore and you can get tongue scrapers, that little rake that you can do that. In India and in China and different, they have handles. Have you seen those? They have handles, and then you really go in and scrape the tongue. And so the rest of the world does that, but in the United States, hardly ever. But it's interesting that manufactured toothbrushes are putting the tongue scraper on the back.
But a toothbrush, that's the trick. Brush it, and just use your normal toothbrush and brush it up and down gums and stuff, right? I do it. It's something I do, and frankly, it feels good. It feels good at night. It feels definitely good in the morning.
Yeah, stimulate your tongue so you can talk better. Keep your tongue in shape for talking by doing tongue scraping. I don't know if that is really something that would fit together there, but yeah, it's just another area in the mouth that we should keep clean.
Yeah.
And as I say, I recommend all these patients of mine who have furrowed tongues, and some of them not only have one furrow, but they have 3 of them on there. Other patients have a completely smooth tongue, and they don't have that problem of having these deep canyons in they collect a lot of things, and they need to clean that. Just because the anatomy is that way on their tongues.
Okay.
So
got it.
So we have toothbrushing, we have tongue scraping, and they're all important.